felt like I needed something to feel negative.
Good evening. Good evening. Yeah, it's not.
I probably look crazy. I ain't even had time to brush my hair or nothing. Being on that bus. No lip gloss. No nothing.
Good evening. Good evening, everyone. Thank you for coming this evening to our Free Public Policy Forum, Race and Infant Mortality in Northeast Ohio. My name is Cheryl Banks. I'm the Communications Manager for the Cleveland Heights University Heights Public Library, and I'd like to welcome you this evening. Tonight's forum is co-sponsored by Case Western Reserve University's Siegal Lifelong Learning Program, the League of Women Voters of Cleveland, of Greater Cleveland, Cleveland.com, and Heights Libraries. And our corporate sponsor is First Interstate Properties Limited. Our moderator this evening is Brie Zeltner of the Plain Dealer. Oops. Pardon me. And actually, before I introduce our moderator, I would like to point out the library has some related programming going on. If anyone is interested, we have something called Babies Need Boxes. This is a kind of a Swedish program. New parents can go through 3 programs, and then they get what's called a baby box. This is a safe sleep space for infants up to 6 months of age that comes filled with a variety of products for childcare. And so that's some programs we have going on here. There's flyers up here. We also have a civil rights related series of programming going on right now called On the Same Page. We are using the graphic novel March, Book 3 by Congressman John Lewis as our stepping off point for a variety of programs and discussions about civil rights issues. So end of commercial. Our moderator, Brie Zeltner, joined the Plain Dealer in 2007 after a year-long internship at the paper and reports on the health effects of poverty on children, families, and also on Greater Northeast Ohio's community. In 2015, Zeltner and colleague Rachel Dissel co-reported Toxic Neglect, an in-depth series that examined the unsolved crisis of lead poisoning in the city of Cleveland. She has written extensively on health issues that disproportionately affect Cleveland's poor and minority children, including infant mortality, asthma, and substandard housing. In 2015, she received the New York Academy of Medicine's inaugural Urban Journalism Award. She is a Cleveland native and resident and graduate of Dartmouth College.
Hi. Hello, everybody. Welcome, and thanks for coming. It's nice to see so many people out here tonight. We are missing a panel member, but I'm going to introduce you to everyone who's here, and hopefully we will see Dr. James in a little while. So I'm going to start on the left over there. Angela Newman White is the Grant Supervisor coordinating countywide maternal and child health programs and services at the Cuyahoga County Board of Health. Since 2013, she served as the co-lead for the Cleveland-Cuyahoga Partnership to improve outcomes as part of the statewide Ohio Equity Institute to address racial disparities in infant mortality. She has over 10 years of public health experience addressing health inequities and disparities and holds a master's degree in sociology from Cleveland State University. Christin, one more. Kendra Harris is a mother of 4 boys who lives in Cleveland's Fairfax neighborhood in the shadow of the Cleveland Clinic. She's a client of Birthing Beautiful Communities, which you'll hear more about in a second. And she'd like to share her story tonight about raising children in the city and how the organization helped her through the stress of her last pregnancy. Christin Farmer is the founder and executive director of Birthing Beautiful Communities, an organization located on Cleveland's east side whose mission is to improve the social and community structures that lead to poor birth outcomes by providing trained birth attendants, or doulas, to women at high risk of infant mortality. She is a doula herself and a native of Cleveland's Huff neighborhood, who has known she wanted to help women deliver babies since the age of 16. She's a graduate of Kent State University and the mother of one son, Jalen. We're going to start with Angela, who's going to tell us a little bit about the causes of infant mortality here and across the country, and where race may play a role in these.
Well, thank you, Brie, and thanks for having me. I was supposed to follow Dr. James, so bear with me here. I was, going to kind of go off of all the great knowledge that he has. But so I'll focus on the causes of infant mortality and kind of what it looks like here locally, and what we're thinking about effective strategies to save our babies. If we consider the number of deaths that we've had, if we look at over the last 5 years, we've lost 668 babies. 68% of those babies were black, but black babies only accounted for 38% of the births in our county. And so, we want to take a deeper dive into what's causing deaths and what are the leading causes and what can we do about it. Prematurity is the leading cause of infant death. So there are any babies that are born before 37 weeks, but most babies that were born before 32 weeks are the babies that are not surviving. So we do have some, post 32 weeks that are making it, but the majority are below 32 weeks. Prematurity accounts for about 60% of our infant deaths, and so a lot of our work has been focused on prematurity. And when we think about, how can we address it, the easy answer is to focus on clinical interventions. Most of the efforts made in this county, and we do house some of the most prestigious clinical institutions, we always revert to let's make sure mom goes to the doctor. But we find that that's not the case. We have to shift all of the work that we've been doing out of the medical model and focus more on the socio-ecological model. So think about things like what race and discrimination, what are the conditions that families live in that's contributing to their overall health and ability to have a healthy baby. In our county, which is one of the most segregated counties in the United States, the majority of communities that are under-resourced have the majority of black and brown people living in them. And it's not by choice, but it's more by design. We're challenging the systems and policies around how do we invest our money, how do we invest in communities. And historically, black communities have been disinvested in, and all the investment has gone into white communities. The Board of Health, and along with a lot of other partners, takes a look at policies like redlining, for example, to kind of justify and to show proof that communities are the way that they are in 2017 because of policies and decisions that were racially driven. And so, when we think about does race play in infant mortality, it's not about race per se. There's nothing wrong with black people or black women. It's racism. It's the systems that are treating people that are not white and not affluent differently and providing resources differently for people. We need to address the systems and not the people, because it's all usually the answer is, like I said, if you just go to the doctor, if you just eat healthy, or if you just do this or that. But we have to question how our communities are providing opportunities for families to meet those expectations. I grew up in Shaker Heights, but if you think about Shaker Heights, it could be one of the more affluent communities, but it's separated by railroad tracks. And depending on where you live in Shaker, the community looks a little differently. So I grew up on the Chagrin-Lee side, which is one separation from the Van Aken side. So Van Aken kind of separates the community, and the houses get a little bit more expensive. The community looks a little bit differently. It also, the residents, the skin gets a little bit lighter if you move past Van Aken. And then if you pass Shaker Boulevard, it changes even more. And so just thinking of my upbringing, what I was exposed to, being a biracial woman with a white mother and a black father, I had opportunities per se, but disadvantages because I am a woman of color. And so, I'm off on a tangent without slides, I'm sorry. But I tell that my own little story to say that, the community that I live in or that you live in is going to play a key role in my ability to have a healthy baby. What the Ohio Equity Institute is doing and the Board of Health is doing with partnership with the Cleveland Department of Public Health is challenging systems and policies. So what are we doing to ensure that housing values are equitable, to where the taxes that are driving the investments in the school districts are equitable? So whether or not you live in East Cleveland or Westlake, you have the same opportunity to have a quality education. To make sure that your community has affordable fresh fruits and vegetables. It's not fair that if you live in the central neighborhood and you're paying $4.59 a pound for some grapes when you're on a limited income, and that's available to you within walking distance. A lot of the transportation cuts and things of that nature are usually done in communities of color, and it's all playing on the stress of the family and their ability to not only get to work, but to get to school, to raise their family. And that is what's leading prematurity specifically, because poverty is the number one risk factor for prematurity, along with mom's overall health. And her health is greatly predicated on her community. And her community is greatly predicated on all the decisions that are made up top that a lot of people don't have any control over. And so I just challenge you all to consider that it's not race, it's more racism. The second leading cause of infant mortality is birth defects. And if we compare black and white infant deaths related to birth defects, there's actually parity. There's no significant change over the last, however long. It's been a while that we've been tracking this information. But with sleep-related deaths, there is a large racial disparity in sleep-related deaths as well. And so the easy answer to that is everybody, which, we advocate for every baby is alone on their back in a bare naked crib. We have never lost a child alone on their back in a bare naked crib. It does not happen unless there is some type of clinical problem with the child. So we advocate with families that they follow these guidelines. If you do this, your baby will survive. But let's think about the conditions that families are subjected to and these expectations that they're expected to meet. So telling a family to do that is not that simple. It's not that simple when you're sleep deprived because you have to work 2 or 3 jobs, or you have to go back to work within 2 weeks because you can't afford to take a non-paid maternity leave. It's difficult if you don't have housing security and you don't have a safe space for your baby to sleep in your home. I get emotional, Lord Jesus. Sorry. It's just not that simple. And so we can't point the finger at people, but find ways to wrap around our families. It's easy to care about a baby because babies are cute and little, and we talk about let's save babies. But until we start caring about mom and dad, we're not going to save any babies. And so, that being said, all that, the disparity between black and white infant mortality is because of racism. It existed 400 years ago, and it exists in 2017. And so until we start to have those difficult conversations, our babies are going to continue to die.
Thanks, Angela. Dr. James was going to talk to us a little bit about sort of the overview of where we are in Ohio and how we got to here, and hopefully we will still be able to hear some of that. I can share a little bit about where we are right now. As of 2015, Cuyahoga County's infant mortality rate was almost double the national rate, and the national disparity between black and white infant mortality is about 2. So it's worse here, but it's worse here in Cuyahoga County. Most things related to maternal health and child health outcomes are worse in Cuyahoga County and in Cleveland than they are in the rest of the country. Black babies in our region die at a rate 3 times that of their white peers. Nationally, the black infant mortality rate stopped decreasing in 2012, and it's not exactly clear. There was a trend that it was decreasing, and that gap was narrowing over time, and that trend sort of stopped in 2012, and it's not clear exactly why. But if black babies died at the same rate as white babies did in 2015, about 4,000 deaths would have been averted that year. So that's something to keep in mind. So we're going to move on to Christin and hope that Dr. James comes. Christin's going to talk a little bit about Birthing Beautiful communities, what they're seeing in their communities, and what their response has been.
Thank you, Brie. So first, let me say, Angela, thank you. You did a really great job laying that out because racism is real, and structural racism, to be exact, is really real, and it's not only affecting our babies, it's affecting our mothers, and it's really affecting every aspect of our everyday life. So when we talk about the quality of life for people in the neighborhoods that they live in, the housing stock that's available, the health, the wealth, there is a wealth gap between African Americans and whites by 228 years, to be exact. So when you're talking about racism and racial disparities, all of this is very much rooted in slavery. And that started 400 or 500 years ago, and we are still seeing those effects today. So I think it's very important to understand the effects of slavery and how that has impacted all of us as Americans today. And again, this is something that we do have to have a conversation about and talk about. I don't want to get off topic. I'm going to go into BBC in a minute, but I just want to preface what I'm going to talk about around birth and beautiful communities to say that, infant mortality also is not a poor Blacks problem. And it's not necessarily just linked to poverty, because an educated Black woman is still more likely to lose her baby than a white woman without a high school diploma. And so that is an alarming fact. And so that should be the forefront of all of our conversations and in the work that we do. And so the reason why regionally or in African American communities, infant mortality shows up the way that it does is because generally African Americans are in a concentrated area. So for example, the central neighborhood, the infant mortality rate there is almost 6 times the national rate. So yes, maybe on a regional level or even on a state level, the disparity is greater by 2 or 3, but in central and in the pilot neighborhood of Huff that we are working in with the Greater University Circle Community Health Initiative, the infant mortality rate is 4 times the national rate. And so if you look at it that way, that means that in central, 36 babies die per 1,000 babies born within that neighborhood. So anyway, I just really want to put that out there first before I talk about birth and beautiful communities. So BBC is a community-based organization of perinatal workers, also called birth workers, also called doulas. The core of our work is really centered around birth doula work and postpartum doula work. But as you may or may not know, a doula is someone who attends labor and delivery with a woman, and they may attend a prenatal visit and may help in a postpartum period. But the services that we provide are very holistic, and so our model is really based off our own model that we created, which is a holistic birth equity model in which we address 9 areas within the woman's life. That's preconception, pregnancy, postpartum, maternal mental health, workforce, education, housing, and justice and legal system, and also entrepreneurship as well. And so all of these things and how we designed our model was all made so that I feel that we have to do everything at once or do nothing, because if we only focus on a couple areas, that's just a Band-Aid, and that's not really getting to the root of the issue. But the root of the issue is systemic racism. So we have to be able to create true equity within our communities. And so that's equity and on a wealth level. That's equity on a health level. That's getting people the education that they want, the career paths that they want, creating the job opportunities. All of this is rooted in community development. That's workforce, economic development, business development, and within our neighborhoods that have long, as Angela mentioned, have long suffered from disinvestment. So for example, the neighborhood that I mentioned before, Huff, which is where our pilot is adjacent to University Circle, which has seen a steady increase of residents within University Circle. But guess what? The infant mortality rate in University Circle is 0. And the infant mortality rate in Huff is 22. Neighboring communities, but you see that it's a stark difference between the two. And so how do we really go about addressing that? So BBC was founded in 2014, And so we have a team of 15 doulas now. And so our doulas provide one-on-one support, and then we also provide group support. So we have 2 to 3 classes a week around nutrition, parenting, co-parenting, even grandparenting classes. And sometimes we have to tell the grandparents to be grandparents and not parents to their grandkids. But it's really a village, and it's a sister circle. And so we also provide maternal mental health as well. We work with a psychologist named Dr. Angela Neal Barnett from Kent State University, and she created the SOS circles, which stand for Sisters Offering Support. And so those are mandatory sessions for our moms. We try to get the mothers in between 20 and 25 weeks of pregnancy. We are there with them during that entire time. At the labor and delivery, we create birth plans with them, and then we are with them until the baby is at least a year old. And so during this entire time, we help them to outline their own goals. What short-term goals can you attain? Hopefully those have something to do around workforce or education or whatever those goals are. We try to help and support that mother through that process as well. We have a health and wellness manager who works directly with the moms around their nutrition, who can go grocery shopping with them to help them pick out nutritious foods, visit the farmers markets with them so that they know what's in season. And we also have demonstrations, or we have done demonstrations, food demonstrations, so that moms know how to meal prep and they can cook for their families. So all of these things all make up the quality of life for someone, right? And so you may be surprised that a lot of people do live in isolation where they don't have that supportive network around them. And a lot of times that's exactly what people need. They need someone to talk to. They need someone to vent to. And, a part of prematurity is the toxic stress levels as well, too, which is why we have the maternal mental health component, because moms are dealing with a lot, So it's not only that we provide the support within our office, but we do attend prenatal visits with the mothers. We serve as liaisons pretty much, or between the providers and the clients or the patients. But also if they have any other, if they need to go to JFS or anything, we are just there to support them along that way so that they don't feel like they are alone in the world. And so in addition to that, BBC is a workforce development agency as well, too. We do train and we hire women from the communities in which they serve. And that's intentional. We pay them well. And again, that's intentional because we're trying to help in our own little way close that large wealth gap, right? We do have a perinatal pipeline, and that in our minds would allow us to be able to help to support that woman if she wants to further her education, get a job, hopefully at the institutions that we work at, for example, such as Cleveland Clinic and University Hospitals and Case Western Reserve, because then they have the Greater Circle Living Program, which allows for you to purchase a home within those same neighborhoods and use that $10,000 to $30,000 to make a down payment. So all of this is around stability, and quality of life, and how can we move people up the economic ladder. But to get back to how this is not a poor Black issue, it really is around the toxic stress piece. We have seen an increase of middle-class Black professional women who are seeking our services. And who can actually afford to pay for the services that we provide because they feel very stressed or isolated in corporate America a lot of times. And as you climb the corporate ladder, you see less and less people of color. And then that causes a lot of stress within itself because then you are sort of expected to conform or be who you're not, change your hair, change how you talk, change, who you are as a person. And that's very stressful. So I just think that for us as an organization, our main goal is to have a healthy birth and healthy birth outcomes. And to date, since we've been around for almost 3 years, we have not lost a baby. We have a 96% full-term birth. Clap for my team. They're here. Team, raise your hand. Thank you. They did that. So yes, we have a 96% full-term pregnancy rate too. We really we want to see not only our babies thrive, but we want to see our families thrive. We want to see the fathers thrive as well too. As I say that, I'm looking at Neil Hodges here in the corner from Neighborhood Connections, who works on the infant mortality. He is the project manager for the infant mortality initiative through Neighborhood Connections, and so he's now introducing the BOSS concept, which is brothers offering a support system, and having men come in to be mentors who are called the doulas, like doulas, but doula. And they're having their first meet and greet and dinner next month. So we're very happy to be a part of that and to support that, because despite what people think, fathers actually do want to be involved in their children's lives. And then, but a lot of times the fathers, they need that support. And there's a lot of supportive services here for the mothers, but what is here and what's available really for the fathers on a grassroots level, though, right? Something that's coming from the community. And that's what makes BBC so unique and as strong as it is because the women, again, they come from the communities in which they serve. So the women that we serve are very reflective of us, right? And so we see ourselves in our clients, and our clients see themselves in us. And so we serve as models and role models, I should say, and mentors in our own right, and just having and helping, and we support one another as well too. And so they get to see shared sisterhood and friendship and being respectful of one another, and how we do that within our organization. So, yeah, that's all I have, Brie, I think. Thank you.
Well, thank you, Christin. I know that a lot of people have benefited from your work so far. And one of them is Kendra. And Kendra wants to talk a little bit about her experience raising kids in the Fairfax neighborhood and her experience with BBC.
Hi, how you guys doing? I first heard about BBC through my care source nurse. Her name is Julianne. She told me about BBC February 3rd of 2017. I started Birthing Beautiful Communities on March the 29th of 2017. At first, with my last pregnancy, I was happy until December 19th of 2016. The reason why is because I've already had 3 boys, and to get an ultrasound saying that you're going to have another boy is sort of disturbing. So I went through a little phase where I was like, oh, I'm not going to do anything for this baby. I'm not going to change a pamper. I'm not going to brush his hair. I'm not going to do anything. And I told my care service nurse, Julianne, that, and she was like, no, you shouldn't feel like that. She was like, I have a solution for you. And she gave me the number to, how you pronounce her name? Kalila. And I talked to Kalila, and Kalila was like, well, she said that you haven't been to a doctor's appointment. I completely gave up on going to doctor's appointments. That's how through I was. And she was like, okay, well, this is what we're going to do. We're going to send you out an Uber, which is one of the reasons why I love BBC, you guys. And she was like, okay, we're going to send you out an Uber, but you got to promise to go to your appointment. So I was like, okay, I'll give it one more try. Then she was like, well, you got to come in to do a SOS. And when I went, I was just like, oh, God, I really don't want to be in here. I really don't like people. And then once I met my doula, Aliyah. Aliyah, can you stand up for us, please? Pretty please. Once I met her, it became so, stress-free right away. I just opened up to her. I broke down crying in the office. She was like, well, why are you crying? What's wrong? And I was like, well, my mother passed away. I'm about to have stair-step kids. They're all boys, and my sister stay in Savannah, and I was a nervous wreck. My original due date with my last son was May the 3rd of 2017. But because I had gestational diabetes, they induced me for the 26th of April. I went to the hospital I got there about 7:55. Can you guys believe my doula beat me there? It was, I went up there and she was sitting there in a chair and I'm like, what are you doing here so early? You know, she went to doctor's appointments with me. She made sure to ask questions that I didn't know how to ask the doctor. One of the main things that I really appreciated BBC for was the birthing plan. I enjoyed doing my birthing plan. And the reason why is because, like I said, I had 3 other boys, and none of my kids have ever taken hospital pictures. Aliyah actually made sure that my baby got his hospital pictures this round. She made sure that I wanted my baby put on my chest. I never had my previous 3 kids placed on my chest. And she made sure that my last baby was placed on my chest. She made sure that the dad got to cut the cord, which has never happened. She made sure that, she made sure of a lot of stuff, you guys. She made sure that the baby's auntie was able to give him his first bath and to feed him, which is what I wanted. Right after I had him, like, she stayed up at the hospital. She stayed checking on me, sending me text messages, good morning messages, asking me, do I need anything, asking me, do I need help. She came over one day. I think I had just came home like 3 days later. And she was like, well, I'm going to take you to the store to get his milk. And I was like, no, I could get on the bus. And she was like, no, you're not getting on the bus. Get in the car. So, like, we went to go get his milk. Like, she's phenomenal. I love BBC. My 2 boys that's back there in the back, they love BBC. My oldest son just turned 7 on the 25th of this month. And the first thing out of his mouth when I said I was going to class was, Ma, are they going to have pizza? And Ma, is Mika going to be there? That's Mika right there, you guys. So as you can see, my kids, they love BBC. I love them. I would tell anybody. I have like 6 or 7 friends that's pregnant now. And I'll tell them, like, girl, you better get you a doula. You know? And they be looking like, for what? Girl, listen, let me tell you. You know, Aliyah, she actually didn't leave my side while I was in the hospital. It was like one experience that I had when we were in the hospital was my kid's grandmother came up there. Everybody knows grandmas can be nerve-wracking sometimes. So she actually made my blood pressure go through the roof. I don't know what it was because Aliyah wouldn't tell me. But all I know is I seen her get up. She went to go find a doctor. And she told the doctor, like, look, her blood pressure's too high. We got to cut her visits down to 15 minutes. And when I tell you, once that lady left out the room, my blood pressure was normal. I was like, well, all right then. Not only that, like, she made it so stress-free when I was in labor. I actually got my hair braided. I got my hair done. And she made sure that we had the ball, the birthing ball. She made sure that we walked around the room. They actually wouldn't let me walk the hallway because I was on Pitocin. But she made sure that I was able to walk around the room. She had the massager. She had the music. She had the tablet. I mean, she had everything except for the Steve Wilkos show. So she was actually fabulous. To all of the doulas at BBC, I want to tell y'all that I love y'all. I'm sorry. It's just that my sister decided to leave once my mother passed in 2009. And me and my sister, we were really close. And once I got in touch with BBC, it was like I had my big sister back, you know. My son, this is actually the first time that he's ever sat with anyone besides me, and my doula have him right now. You know, and I love you guys. Even Mika, guys.
Thank you, Kendra.
Thank you.
I know, so I wrote a story about BBC a little while ago, and I heard from the folks there how much you wanted to tell your story, and I'm so happy that you were able to tell it tonight. So thank you for being here. So we wanted to open it up to questions. I have some of my own, but we also wanted to make it easy for people to, you should have cards and pencils. If you need any, raise a hand and somebody can give them to you. You can write them down, but we also have a microphone. If you don't feel like writing it down, or if that's just not your style, we can pass a microphone around if you have questions. I also have a couple up here that we can start with. So first one I'm going to start with, what advancements have been made while we have lagged behind in prenatal care, racism, and other factors that have led to the dire circumstances we find ourselves in? Angela?
What advances have we
What
made?
advances have we made?
Well, as from the Ohio Equity Institute lens, we focused a lot on trying to provide opportunities for families to avoid premature labor by putting a lot of our support behind the Centering Pregnancy program. Centering Pregnancy is a group prenatal care model that prior to OEI's kind of inception back in 2013 was only offered at university hospitals, OB department, and neighborhood family practice, which is a federally qualified health center. Through the collaborative efforts of OEI, all of the partners across the state, we were able to expand Centering Pregnancy into all clinical systems across the county. So no matter where you go to receive your prenatal care, you have access to this Centering Pregnancy model. And what's so great about it is that, you know, women with similar gestation can attend every single prenatal appointment together. So to speak to, you know, the great work that Birthing Beautiful Communities is doing, Centering Pregnancy provides support to women throughout the entire pregnancy. You're able to form relationships with all of the other women and simultaneously go through labor, well, not labor specifically, but go through your pregnancy together and have your babies around all the same time. And so that's a big advancement because it's a different way of doing business. Clinically, most folks are doing that one-on-one with just a doctor, but working with midwives and making sure that women have an opportunity to not only have regular, real conversations with not only the physician, but other women is a different way of providing care. And so as a county, we are the only one in the state that has expanded to all systems. That's all federally qualified health centers, and all hospital systems are now doing centering, which is a big win. And we have the state kind of looking at us, you know, to see how we're doing. The second one is around access to long-acting reversible contraceptives. Those are IUDs and implants. And so, you know, if over 50% of pregnancies are unplanned, and unplanned pregnancies are more likely to end in a adverse birth outcome. And so how can we empower women to have the most effective forms of birth control being available to them? Traditionally, those forms of birth control have been marketed towards older, married, white women. You know, you're married, you don't want to have any more kids, get an IUD, and you'll be okay for the rest of your, you know, your parenting years or whatever. It hasn't been traditionally available to Black and brown women, single women, and so we've been working really hard with all the systems and with Medicaid to make sure that access is available to all during the same day of your appointment. Historically, folks have been told to come back if they choose this form of contraceptives, come back in 2 to 3 weeks once you're approved, which is unrealistic. And so we have some same-day providers across the county, and also they passed legislation to where women can have access post-delivery to IUDs and implants, which is a big win because it's good for up to 10 years. You can keep it for a month, you can keep it for 10 years. It's kind of a set it and forget it type of deal. And the other kind of stride, I guess the last clinical stride is around the progesterone therapy. So there is an intervention available to women that have had a previous preterm birth to where they can receive injections around 18 weeks gestation through 36 weeks that can keep the baby in the womb. It hurts. Yes. Some people it hurts. But the baby stays in there. So we're trying to make that available because when it first came out on the market, it was super cheap. But when it became readily available, the pharmaceutical companies hiked the price, and so it wasn't being offered to populations that were on Medicaid. And so we've been trying to work with hospital systems to make sure that those barriers don't exist so all women have access, and then trying to find ways to get it to people. So can we provide them in-home visits as opposed to having someone be expected to go to the doctor every single week? It's just, you have to take time off work. You got to get there. It's a lot. And so trying to address those barriers. With regards to racism, with the strides there, so we're having these conversations today. So this is a win, I'd say 5 years ago, nobody wanted to talk about racism. That's like the elephant in the room. People are scared to say it or to acknowledge, or people may have some internal issues that they might be dealing with to where what we're trying to do is address some unconscious biases that people have, but to acknowledge that policies and decisions made in the past are setting the stage for what's happening today. So how can we undo some of this work to make it equitable for all? We're not pointing fingers at any one person, it's just the overall system. And so that's just some kind of opportunities that we have taken advantage of over the past 5 years, and we're hoping to continue to make strides because we have a long way to go.
Great. Thank you. Here's one for Christin. How are expectant mothers connected to the doulas in your program?
So most of it is word of mouth, because the women, again, they do the doulas or the birth workers, they do live within the communities of the women in which they serve. So a lot of it is word of mouth, but we do have partnerships across the city and across the county. Planned Parenthood, they make a lot of referrals to us. We work with WIC. We work with Center in Pregnancy at university hospitals, the midwives at university hospitals as well. Hey, Dana. So because we work with the Center in Pregnancy program at university hospitals, and we are invited to the sessions, the moms are in within about the second trimester, then we definitely get a lot of referrals that way.
Great. I'm not sure who wants to answer this one. Cleveland is also one of the most digitally divided cities in America. Neighborhoods with high infant mortality rates have some of the worst connectivity rates. Are you looking to partner on digital inclusion initiatives? Anybody have thoughts on that?
Digital inclusion.
I have a quick thought, and I'm looking at you, Neil, because Neighborhood Connections and the Greater University Community Health Initiative has two focuses. One is on infant mortality, and the other is lead poisoning. And so I know that when the team went out into Glenville, because Glenville neighborhood is the pilot for the lead poisoning team, and they had iPads, right? And they were doing a survey, door-to-door survey in a Glenville neighborhood, and those iPads were connected through Verizon. All of the team quickly realized that there were not a lot of Verizon towers around in that specific neighborhood that would be able to connect them to Wi-Fi or just connectivity so that they can get the data that they needed from the residents. And so they had to resort to doing pen and paper surveys. And so why that is important, that's a disparity, right? Because why in I live in a Glenville neighborhood and I have Verizon, right? So I don't know if that necessarily answers the question, but that's just an example, I guess, as far as the digital divide and connectivity within that neighborhood. I was very surprised to hear that as well, but that's a true story.
Hold on, we've got a microphone for you. Okay, we're gonna start back there. Or maybe not. We'll just wait. Hold 1 second. She's coming.
Yeah, my question is political. I wanted to know what support you're getting from the politicians in this community who have so much power over things like community development money and trying to improve housing and services that people need, and the safety for women and families in the communities. Because I'm afraid for friends who live in Glenville, there's so many shootings, and in Garfield Heights there are shootings. There's shootings all over, and you know, what are the politicians doing? Are there any politicians here today? You know, I'm really concerned about what supports you have from people who handle the money, and you know, to get the services that are needed for these families.
That's a good question. I had the same question, actually. I mean, in all honesty, you know, again, we're a community-based organization. I'm not here to save feelings. You know, our allegiance is to the community and the women and children and families within that community. And so I had the same question, you know. A lot of people can act like they really don't know what's going on with the infant mortality rate. I don't know how many times I've had conversations with certain individuals who claim not to know about these issues in their own backyard and, you know, and in their neighborhood. And so, you know, this is election season right now. And now some are taking an interest in what's going on. But overall, I can say honestly, no, there is nothing. I had the same question.
I think you need to get organized and approach the politicians and demand the things that you need for families. I think, you know, that people need to learn to speak up for themselves and get the services that they need, and not have money going to improve stadiums and things like that. There are needs that the people, the families have in this community, and they should be addressed first before games that people can't afford to go to.
I will just let me say that, you know, Dr. James is not here, but he would have said, and he does mention that, you know, the last time we ever saw any improvement in infant mortality to where the disparity started to close was during the civil rights movement. And so that speaks to the importance of a social movement and the involvement of all people in changing, you know, how we disseminate resources and what we're doing to invest in communities. So I agree 100%.
Hold on, just a second, Bernie.
We'll answer that question because our mayor and county have been working pretty hard. I just want to make sure. Hi, Bernie Kerrigan, First Year Cleveland. Our mayor and our county executive and city council president and county council brought in $4.9 million from Medicaid. I know, Christin, you guys got what, about 1.1? Yes, they did. Yeah. So I think I just want to we have to do more. But there is about $4.9 million that was brought this year alone to start working on really getting the dollars to the frontline staff that know neighborhoods and have the trust and to make a difference. So centering, home visit programs, sleep-related, fathers programs. They did go to what I would call neighborhood programs because what we've learned is you need neighborhood programs, high-quality health care, employment, and education to work together. There's several of us in this room that are tomorrow helping work on a grant to get some housing assistance dollars that the state is really looking for us to lead. So ODH and ODM, I think, I haven't been in this kind of arena. It's just recently over the last 9 months, but I do think they're beginning to hear, but we have to have a collective voice.
Thank you for that, Bernie. But let me add to that to say this. I'm more so referring on a local level, okay? Because these are neighborhoods that I grew up in, that I still live in. So it's not necessarily just about the infant mortality part of this. Again, it's the economic development. Are jobs coming into the communities? Are people getting those jobs? Are they paying enough money for people to actually live in those within those communities? So I think that for us, again, it is what it is.
Hello, everyone. Hello, everyone. My name is James Jerome Bell, and I was born 3 months premature over 50 years ago. So you can imagine the advancements that Angela was talking about from 50 years ago. So it's like almost a miracle that I'm here. But one of the things that I wanted to say is that, children are an inheritance from God. And by them being an inheritance from God, we know that even under the harshest circumstances, some people, including children, will thrive, even become exceptional. Now, I feel for the children because they are our future, and we need to continue to make this ground zero and the epicenter of change, because with the challenges that we have comes opportunity. We have the opportunity to turn this thing around and do something very beautiful and save lives. But it starts with the end of systemic racism, because most truly I say to you today that we must be brothers and sisters of all colors and realize that there's only one race, and that's the human race.
Thank you. I'm going to go to a couple more that have come in. You mentioned that African Americans live in clusters, and these clusters have higher infant mortality rates than other areas. Do you think that living in clusters helps because of the sense of community that BBC is trying to provide, or do you think it hurts because everyone has similar stressors?
I don't think it really matters whether or not people live in clusters or they don't. I mean, the infant mortality rate for Black women is the same no matter what community they live in. I mean, in the suburban areas, Black women still face the same rates that they would even if they lived in a more impoverished area. It's just that in the suburban areas, they are sprinkled out a little bit more, right? And so that doesn't take away from the issue of systemic racism being at the root of all of this. So it doesn't matter if you're a Black woman living in Solon or you're a Black woman that lives in Central, you still are more likely to lose your baby just based off the fact that you are a woman of color. So I think it has less to do. I only made that statement because when we look at the maps of where the highest rates of infant mortality is, it's also the neighborhoods that have the highest concentration of African Americans within that community. So that was just the reason behind the comment that I made, but it really doesn't matter where Black people live.
I've never seen a Black or white person. I keep saying that. I just can't actually say that. Can you elaborate on that? What is a Black person? Her shirt is black. My shirt is black. I don't see any Black people or white people in here. I'm sorry, I just couldn't. I heard 100 million times in my life, I've never seen a Black or white person.
So what would you call them?
I don't know. You don't want me to get to start talking, man.
Well,
I swear
you got started. So
But
what would you call them? African American,
Well, you
a
can
person
still
of
be
color,
ignorant and say black and brown or white.
Yeah, I mean it's just all in context.
Okay, well you can just
words.
stay ignorant. I'm sorry. No, ignorant.
All right, let's try and stay focused. So we have a question for Angela. You mentioned past policies and decisions regarding race and inequity that have gotten us to where we are today. Could you talk more about specific policies or laws or ordinances that exist which are barriers to your work and that of your fellow panelists?
Well, I gave the initial example of redlining, and so that's, where banks decided how much. Well, they basically rated communities, and if there were Black or brown or African American people of color living in communities, they received a lower grade, and so banks were not providing loans and kind of providing loans to white residents to move in specific communities, which has resulted now into the higher concentrations of specific groups living in communities. And that's a racially driven policy. Another one that we don't really think about is, the Medicaid family planning waiver. So historically across the nation, it was available since 1982. So women and men could get reproductive health services based off of their income. Ohio, which is a conservative state, did not sign on until 2012. So 30 years it took Ohio to allow women to get free or reduced cost reproductive health services. And it just so happens that when this happened, when the 2010 infant mortality rates came out, where Ohio was tied with Indiana for having the worst Black infant mortality across the nation, Indiana was also the only other state that did not allow women to get free or reduced cost reproductive health services until 2013. And so this, you can say, maybe it's not racially driven, but when a decision disproportionately advantages one population or another over another, you can insinuate that there is a racially driven kind of motive behind it. If we look at mass incarceration rates and how, the percentage of Black men that are currently incarcerated versus that are stopped or arrested or even go to court, a lot of those decisions are based on race, which has totally dismantled the Black family. And when we think about decisions around support through county dollars like welfare or things like that. Traditionally, you weren't allowed to, and historically, you weren't allowed to have a man in the home, or you lost your supplemental income. So what did that do to the structure of the family? And is that racially, motivated? I would also like to say things like, with our state being conservative, health is not a required core component of our education system in Ohio. There's only 2 states that don't require health in the schools. So, which is one of the reasons why Ohio and our county does not provide comprehensive sex education in the schools, because they have a choice to do that. And so it's basically up to the schools on whether or not they enforce it. And so the more affluent districts may be able to afford to bring in people to provide this information to the students so they can make the best health decisions for themselves. But communities like in our first ring east side suburbs, where we have had high up to 40% teen pregnancy rates. We're doing the teen pregnancy prevention program. We received federal funds to administer comprehensive sex education in all of the first ring east side school districts. This president decided to take it out of the budget. And so in the middle of our 5-year cycle, he cut it out. So all of the students in all of those suburbs are no longer going to receive the education because it's not a part of his plan. And so, I just say that when any decision or policy is made and it disproportionately disadvantages a group of people, that's a problem. And that's a barrier to the work that we're doing.
Thank you, Angela. Sure, let's go there.
I think the question may have been partially answered, but not directly that I had. You said in the beginning how the rates of infant mortality, lead poisoning in Cleveland is, I guess you were saying, the worst in the country, or among the worst in the country. Why is Cleveland so much worse than any place else? Any thoughts on that?
With the lead?
As far as the lead goes, that's for houses that was built before 1970. Yeah, and so a lot of the housing stock still exists in Cleveland, old housing.
It's also a policy issue. So there are many other cities in the country that have old housing stock like we do. but there have been a lot of policy decisions made in Cleveland and decisions about how we inspect rental properties, for example, that have impacted whether or not, kids are exposed to the lead that's in those houses. So that's one of the primary reasons driving why we have high lead poisoning rates. So there may be the same kind of housing stock in other cities, but they might be inspecting the house before kids are put in there, where that's not happening here. I'm going to do one from here before you go back there. And I would like Kendra to answer this one if she can. So I know this is a larger community issue, but what do you all think midwives, nurses, and doctors can do on a one-on-one basis to make progress?
Well, as far as the midwives go, I actually think that they do an excellent job just being how supportive they are. Like I said before, I love my doulas, all of them. Even though I only had one doula, nobody could replace her. Not me, nobody. But I love all of the doulas. As far as the doctors go, I don't really know because ever since I got a doula, I barely even talk to the doctors. I go straight to my doula.
Do you feel like I know you mentioned
there's no disrespect
that
towards the doctors or anything, but I just feel like my doula team, they know everything to me. Mm-hmm. They're excellent. So
you mentioned that your doula helped you ask questions that you maybe didn't know to ask or might not have asked otherwise.
Yes, what she did was, for instance, when they got to talking about, we're going to have to do this and we're going to have to do this, and I was like, what does that mean? Mm-hmm. And then she was like, well, I'm going to talk to them.
Do you think that's something that doctors could work on, though? That nurses could work on?
Yes, they could work on learning
easier?
how to communicate with their patients to where their patients could actually understand what they're saying for those who don't have doulas. Right. But like I said, I call my doulas for everything. My babies get a cold, I'm on the phone talking to India, calling Mika, calling Aliyah, so.
Do we have one back there?
I guess I didn't expect to cry as much as watching. And I mean, the program sounds, it seems like it's made so much progress and so much difference. I really want a doula, and I have no reason to have one. And but please. Okay, but the other thing, go ahead.
You know what, though?
What?
Like I told them, I just recently did a interview with them for Kent State Radio. And like I told them, when my baby turned 1, I don't know what they're going to do because they're not getting rid of me that easily. So they're stuck with me forever.
Kendra is the
I guess my question,
alumni president.
My question was, what could somebody who has some spare time and has been working with kids forever, and what can I do? What can we do? Because don't all answer at once.
I'm sorry, you said what can you?
What can I do? I mean, what can I do to help this thing? I mean,
help the organization itself, or just sure.
I mean, are there volunteer things that?
I would like to invite you to sit in one of our classes. Is that okay? So, no, seriously, because when we talk about everything. Sometimes we get off topic to where we can't even cover the classes because we're just one big happy family. So it's always somebody in there crying, so just having a good support person, I feel like that's more than enough. Now, as far as what the doulas want, I don't know. But me being a client, I feel like just having support. And like I said, this is no disrespect to you, but my mother passed away in 2009. All these doulas are mainly around my age, whether they know it or not. So to have a older person there, it'll be fabulous. My kids, they come to the classes every time we have them. and my kids have never met their grandmother. I mean, of course, we got Verna and Miss Deborah, but they're doulas. We can't take other people's doulas for grandmas.
Angela, any thoughts on that?
I mean, so the Ohio Equity team is, professionals and residents that participate on some strategic planning to address the needs of communities. Right now, we're doing a lot of work in the 44128 zip code. And so if you wanted to forward, if you have some contact information, maybe forward to Brie or the lady that's organizing this, sorry, I forgot your name. We can put you on the listserv, and you can be, kept in the loop, because there's always opportunities not only to raise money or for donations for things. We're always trying to find ways to get resources to families, things like car seats, strollers, pack and plays, nursing bras, things like that that are hard to come by. If we can get them in the hands of families that need them. Oh, yeah, we've got lots of those. Yes.
Thanks. I'm going to try and get to a couple more of these because I have a bunch in front of me. Can one of you clarify why educated middle-class black women and babies are more at risk than white ones? Why isn't poverty the essential factor?
Because racism is. And again, I talked about it a little bit before, but as you climb the corporate ladder, you see less and less people of color, and that is stressful. Because I think, again, what makes BBC what it is because we, we share that culture, the culture aspect of things. And so things that Kendra has been through, I have been through. We see each other out of a very familiar lens. And so I don't know if anyone has ever seen a documentary, is it When the Bow Breaks? It's an older documentary, but they highlight a young lady in there who's an attorney, she didn't lose her baby, but she had a premature birth. And I have several friends who are professional black women, middle-class black women, who have had babies very early, And again, it's that toxic stress of just being black in America every day. It's not just about you. You're worried about if you have a black son. You're worried about how your black son is going to be treated, how your black father is going to be treated, if he's going to be stopped by the police, if something's going to happen to them, is he going to get the same treatment? Are you going to get the same treatment that you would if you were not a person of color? I shared a story earlier in the grand rounds I was on this morning, and said that I suffered from an ectopic pregnancy some months ago, and I went to the emergency room, and I was in the emergency room waiting for almost 3 hours, which we know that could be fatal, right? Would I have received that same treatment if I wasn't a woman of color? And so that's stressful, because I almost left the hospital, right? Because I had waited so long. And I didn't know, of course, that's what I was suffering from at the time. But what if I had left, right? I may not be on this panel here tonight. And not to be so dramatic, about it, but that's just the reality, of it. And so even within my group and within my team, we all are African-American women that work within our office. I'm at work, I'm more at home. These are women I know, and, and I'm comfortable. But as soon as I go out into the world, right, and then I have to attend a lot of meetings and do a lot of things, and it's a different scheme of things, right? And then I'm suddenly isolated in a lot of settings. Or when I come to meetings that we're talking about black people and we're talking about racism, I'm the only black person in the room, right? And so, again, those are real things that can contribute to toxic stress. Now I've learned not to let people stress me out, though, right? So I meditate every day, and I don't carry any burdens on my back. But you have to learn, to get to that place. It's coping.
I just wanted to add to that a little bit. This the problem has been studied for a long time because it's been around for a very long time. So, initially the assumption was that yes, this was a poverty problem, and so there was a lot of that it was a poverty problem. It was an access problem. So there was a lot of research and money poured into getting women more access to prenatal care, and we improved that a lot. And there are very few women who don't have access to early prenatal care now, and still the problem exists. So. There have been a lot of studies of this problem over the years, and when you control for socioeconomic status, when you control for income levels and education levels and all smoking and all of these other things that you would think would be sort of obvious factors that would contribute to infant mortality, you still can't account for this. You can't account completely for this difference that you see. So yeah, poverty plays a role. Certainly, we don't want women to be struggling to make ends meet daily. That's a source of stress. But you cannot account for the entire difference, that gap, by saying that it's a poverty issue, and that's what Christin's trying to say.
Let me just make a comment as well that Black women in other countries have healthier babies, so it's about living in the United States. It's something about here that's bad, and and it's 3 generations back. So even a more affluent, Black woman, educated, if her mother was stressed out and felt stress and racism, it actually affects the genes, her baby, when she's in utero. And so it's 3 generations, especially if she's pregnant with a female. So we're talking about mom who's pregnant with a female who's now developing her, ovaries and everything. And then that's affecting her pregnancy moving on. So it actually follows 3 generations of stress back. So even if we consider, where a person is today, what her mom went through is affecting her ability to have a healthy baby as well. Because my sister-in-law grew up in East Cleveland. My brother was making 6 figures. All of my nieces were premature, all of them. And got some claps back there, but let's not clap for the premature babies. But so it's. And they grew up in East Cleveland, and her mom faced a lot of, different life circumstances. And though my brother moved them way out to Arizona in this nice community, all of my nieces were early. And so, the situation doesn't change. Your current living situation, your conditions doesn't change what historically has happened in your family.
We have another one, and actually, there's a bunch of research on the preconception period being more important to birth outcomes than actual the pregnancy period. This one's for Angela. Why is energy being put into a baby box effort in the community when prematurity is the main issue? Are baby boxes needed?
Well, as a public health employee, we do not have a position on the baby boxes. We advocate for the pack and plays. We are a Crips for Kids partner, and through the state, we provide free pack and plays to anyone who is 32 weeks pregnant or caring for a child under age 1. But the health department, because in the United States it has not been tested, we cannot have a position on the baby box.
I would like to say something. My name is Selena Cuyahoga, and I'm head of midwifery for University Hospitals. I'm also one of the founders of the nonprofit Babies Need Boxes. The baby boxes have been tested. They meet CSPC certification or testing standards. Those are all available on the web of Baby Box Company. The reason that this initiative is important is because it provides not only a safe sleep space, but also the education that patients might not always get about safe sleep conditions. So we offer this free of charge. It is free for anyone in the state of Ohio. And University Hospitals is giving out the boxes, and we're looking to push that out to all of our birthing hospitals. Birthing Beautiful Communities is one of our partners. And so, it's an effort, and pack and plays are not always, while it's a wonderful and a much needed resource as well, it's just like the one size does not fit all mentality. For some people, a pack and play is not a reasonable place to have in wherever they live, in their bedrooms or whatever. And so they might need another portable space. If they are more transient, and they're moving from house to house, and it's a little bit easier maybe to pack up everything in the box and take it to wherever they need to go for their children, or if the baby's gonna stay with grandma or aunt or cousin who's gonna watch the baby. It's sometimes an easier way to pack that up, and so that they know that there's a safe sleep space wherever they go.
Just to touch on that real quickly, I think the question was really, thank you for that, by the way. I think the question was really about why target that issue when prematurity seems to be the primary problem, and that's obviously a safe sleep initiative. So Angela, can you answer that?
So so safe sleep is the 100% preventable cause of infant death. Right, still number 3. And so we do, yes, it is still, number 3. I mean, we do lose 25 babies a year in our county. I know we equate it to a kindergarten classroom. 2 babies every month die in an unsafe sleep environment, but it is not the leading cause. And so unless we address prematurity, we're not going to make any, progress in infant mortality. And so we do have some programs, but programs are not going to fix prematurity. A program could could address sleep-related deaths, but it's not going to address prematurity.
To try to prevent. Like, we can't just target one thing. There's 3 different things that we know, so there has to be multiple efforts done across the county so that we can hit it in all directions and all layers.
Absolutely. So I have an interesting sort of big picture question. Anybody feel free to try and take a crack at this one. How would single payer health care affect birth outcomes for Black families in Cleveland? Single payer health care. Yeah.
What is single payer health care?
Let's see, universal health care.
Universal health care.
Coverage.
Oh, well, I'm a fan of universal health care in the sense that, we have to make sure that health care is not a barrier. People should have access regardless of their income and regardless, of the insurance carrier that's paying for their insurance. I think that universal health care could be a benefit as opposed to providing a lot of the individual opportunities for businesses and things of that nature. I know it would be more expensive. People say that it would be more expensive overall, but I think to ensure equitable access is ideal, in my opinion.
I think we had one here. Oh, sorry, one there. Okay. All right. Uh-oh.
Hi, everybody. I just wanted to say, in conjunction with what everybody else has said, people are missing like a big piece of the puzzle. It's if you get birth control, it's hormone related, and hormones are responsible for the production of life. Okay, if you get birth control, it's going to mess up your hormones. And I mean, a lot of the so-called Black people are in Cuyahoga County. If you go down Noble, the prevalence of like Whole Foods and good food options are not there. It's like, based on how much you make, you can only get this kind of insurance. If you have this kind of insurance, you can't have a water birth, or you can't have this, you can't have that. And it should just be, if that's what you want, that's what you should get for the environment of your baby, because it's a newborn baby. As opposed to a Caucasian woman, they get to go somewhere else and have like a spa delivery, as opposed to brown-skinned women who have to go to a hospital where there's death and grief and all kind of other energy in and out their door with a new precious life. Like, it's a whole spiritual aspect. Plus, factually, Bill Gates is the one who funds vaccines, and he said that the world population is getting too high, and he can reduce it by 10 to 15% if he does a great job on new vaccines and healthcare and all kind of things like that. So that's a big thing that people should look into. And race is a key word in this whole thing, so that matters, because if you label somebody Black or white, you're saying that they're pure or impure. Like, those are adjectives, and that matters. It's not a joke. It's not funny. Everybody's a person of color. And if you say you're white, that's basically saying you're better. Like, if you go to Cuyahoga County, they don't have Popeyes and other McDonald's and all that other stuff. Like they have Starbucks and Subway and, you know, just better options, better life. Like it's not, I mean, fluoride is in the water. It's like a whole big picture, but vaccines, pregnant women should not get vaccines. Like I've been a guinea pig. My doctor has told me, oh, you're not doing the right thing if you don't get a vaccine while you're pregnant. But I know I have 3 children. I read a lot. I'm not a doctor because I didn't go somewhere and, you know, have somebody prove what I know, but I read a lot and I know vaccines are not for pregnant women. And the so-called black people, they've been targeted. Preconception, what are the mother and father eating? What is their cellular structure like? You know, all that stuff matters. If you're so-called white, you're gonna be out in your own land, in your own big house with your family all together, not in jail, not separated, not with all this stress. How am I gonna get food on the table? How am I gonna pay for this, pay for that? Well, white people, they have, you know, strived off slavery, and that's not fair. All these people, like if you go to Wendy's, they get minimum wage, that's the legal minimum for their work. That's hours of their life, as opposed to a CEO from a white person. They're on an island somewhere, and they're just chilling. They don't know what real work is. Like it's not. It's a whole big cycle. Like the stress factor, the environment. Is there smog? Is there transportation in your city? In Geauga County, it's not like that. There's barely any smog. You know, all this stuff. The health of the people. If you're walking, you know, all this stuff matters. You know.
Thank you. Yeah, oh boy. Okay. Oh no.
I'm Dana Langford.
Does the panel want to respond to that last comment first?
Hold on.
There was something that was said about tub births and private insurance that was completely untrue. My name is Dana Langford. I'm one of the nurse midwives at University Hospitals. We are one of the hospitals that services probably a majority of the African American community, first of all, in Cleveland, and the Medicaid population in Cleveland. We do offer tub births. I've actually just done 3 with CareSource. So to say that tub births are only happening with private pay patients is completely incorrect and misinformation. It is available to you if you are a low-risk patient. It is available to you. It doesn't matter what your insurance is.
I'm doing my job. I need to do what's right with the heart set.
Okay, so if you are a low-risk patient and you come to university hospitals and you can be serviced, and as I know, as of right now, all 3 hospitals as well are getting ready to start a water birth study. So it does not matter if your insurance, if you are a low-risk patient, you can do water births as well. There was other misinformation in that statement, but I just wanted to address that because that was an attack on hospital systems and the insurance payers.
Thank you.
Okay, I think we need to kind of get back to the focus of the forum.
Okay, thank you. Okay, so we have another one here. This one is for Christin. First, it says you're awesome with a little heart. Are you looking to take BBC's model and expand it to other communities and cities?
Yes, is the short answer. We are currently looking into expanding into Akron and Summit County. We have been approached some time ago about it, but they also, of course, have a high infant mortality rate. And of course, we want our model to go national. We want to employ people within the communities all over the United States.
Just a follow-up one for Christin. How are doulas trained? And it sounds like very intense work. Is there a burnout factor?
So, doulas, if a birth doula or postpartum doula, can be trained through several organizations. DONA is one of them, if you just want doula training. Doulas are trained to, again, be present at the labor and delivery and have some training around breastfeeding and prenatal care. But generally, doulas are trained to create their own business so that they retain clients on their own and those clients pay them. What we do is more of perinatal support. And so we do our own in-house training. And so we do an 8-week training around all the areas around quality of life. So yes, birth and postpartum doula services or training is included in that, but we also train around healthy homes and social emotional intelligence, all of these things that make up a whole person. So our training is very exclusive to our program.
And is there burnout?
Oh. I'm not burnt out. Is any other doulas burnt out?
No, my doula actually love me, guys. We text, like, literally, we text every day. I send her pictures of the kids. We say good morning. We texting good night. That's my sister. I love her.
I mean, and let me just say this too. You know, this is not a profession. At least working with us, it isn't a profession that you can just sign up for or register for and just come and train. It's not this open sort of training. I mean, we hand select the women who are trained with us because you have to have passion in order to do this. This is the only way that you will be able to survive and do this, you know. I mean, prior to us growing our team to what it is now, I mean, when we started off, everyone had full-time jobs and were volunteers. So you have to have passion in order to do this. And so that's a part of how you know this is or isn't your calling around, you know, how overwhelmed you can become and doing this work, because it is taxing work. You know, you are essentially responsible to some degree to providing a lot of support to the women, but you are forming authentic relationships with those women as well too. So it becomes less of a job and just more of a relationship.
So we just have a few minutes left, and I wanted to ask each of you to, if you could tell the folks in the room, if there's one thing that they could do to make a difference in this area, what would it be? Angela?
So my recommendation is to tell someone else something that you heard today. So someone that wasn't in the room, I need you to share if you learned something or if something was of interest, to make sure that we continue the conversation, because it's going to take, as Christin said, it's a village, and you know we need the support of all of our community members.
I would say give someone a hug. And the reason why is because, like I said, everybody needs that extra support. Everybody needs that extra love. You know, I hug Mika every day, and Laura knows. Me and Mika, we have our differences. But nobody better not mess with her. See? So I would say give someone a hug.
I would say, even though there's only, I think, 3 sessions left, I'm a big fan of the Racial Equity Institute that's being hosted by Cleveland Neighborhood Progress for the entire year of 2017. It's a really in-depth 2-day workshop on racism in America and the history of racism in America. And it's very intense and it's deep. The other one is called PRISM, and that is done out of Neighborhood Connections. It's done by Adele and Erica Merritt. And again, and that's more, and that's very intense as well too. And I recommend that for everyone. It's not race specific, but I think that that's a good place to start, because if we don't understand, I'm going to take this from a video I just watched a few days ago. If we don't understand what the it is, how can we solve it, right? Because again, it's not just infant mortality. I mean, African Americans have the highest rates in almost everything, right? You know, so it's just about disparities, period.
Thank you to all of you for joining us. And oh yeah, we have time for one more. Thank you.
Good day. I want to thank you all for having this forum. I'm Angelique Jefferson, and my question is there a program in place for preconception preparation that will support women who deal with infertility or fertility issues, or just helping women prepare, young women prepare for motherhood, childbirth, pregnancy from a holistic approach? Because I heard prevention mentioned, as well as things that can disrupt the hormonal level, which can affect pregnancy and infant mortality rates. So I was just wondering if there was a program in place to support prior to pregnancy, in conjunction with prevention. Or
I know that's what you do.
Yes, that is what I do.
and you're really good at that. So yeah, I don't know. I mean, I won't say this, but I think that it's a crucial component, to all of this, is preparing not just the body, but the mind and soul to bring another person into this life. And I don't think that people truly understand what it means to always give birth. It's not necessarily just about the financial aspect of having a child, right? But how mentally prepared are you to have a child? How emotionally prepared are you to have a child? So I think that it's something that, let's talk again some more.
Well, thank you to all of the panelists, and thank you to everybody for coming.